I'd like to give you an after-hours, behind-the-scenes tour of Total Care Dental. This is where I work. This is where we do what we call our magic. So let me show you a little bit about how we started and what we are today, what we have today. So this is my original office, and we opened this office, we built this office in 2001. So we've been here a long time, 22 years, a little over 22 years in fact. This office was kind of a dream come true for me. I built it with my father, so I had been a practicing dentist for about 4 years in another dental office before that time. He'd been practicing in another practice for 20 years. And together we decided we wanted to build this practice and do it on a premise of patient care. We wanted to basically change everything that everybody hated about the dentist and make it better. Now, we can never take away the fact that we're working on your teeth. That's part of the issue, but we really wanted to make things great and the experience as positive as it could be. So see that little statue right there? That's kind of our claim to fame. We won Best of State numerous times in the healthcare category, but one year we won the entire category of consumer services. We beat out things like huge car dealerships and hospitals and hotel chains to be able to do that because of the care and customer service that we were providing here. That's how we started for many years. And then you probably know my story about how I got sick. In getting sick, I actually put the practice for sale. My father sold his portion. I put my portion for sale because I didn't think I was going to be able to continue doing this. Found out it was actually mercury that was the problem. So this is, spoiler alert, that's my story. It was mercury and removing mercury fillings. Well, in finding that out, I realized I had to do something different. So what did I do? I figured out that I could remove mercury fillings without breathing them in, without getting sick. That's what we started to do to change what we do here at the practice. It was for me, for my own health. I wanted to be able to continue practicing. So I found that there are protocols where you remove these fillings safely. So we have all sorts of things to be able to do exactly that. I'm going to show you a few of them right now. We have closed rooms. These are actually one of the only rooms west of the Mississippi that do this. We have closed rooms, closed doors, and this is where we do a lot of our safe mercury removal. So in these rooms, we have special filtration systems, we have special vacuums that we use along with all sorts of barriers for you. We cover your face, your skin, your nose, your airway, and we have a giant vacuum that sits your chin, all these kinds of things. We also protect ourselves. So these two rooms are our safe mercury removal rooms right here. Now, what else do we do here that's a little different? That's what I started with. And then doctors started saying, well, do you also do ozone? Well, I didn't know what ozone was. I had to learn what ozone was. I'm looking around for one of our ozone carts here. So here's one of our ozone carts. What ozone is it's a natural disinfectant. It's just 3 molecules of oxygen together, but those 3 molecules of oxygen like to break apart, and that one single molecule goes and finds bugs and kills them. So I learned we had to use ozone. What do we use ozone for? So many things. It can take care of bacteria in a gum disease area. It can clean out a surgical area. It can disinfect a tooth before we do a filling so that we can preserve a tooth and not have to do root canals. It can desensitize a tooth. It can clean up sinus infections. It can clean out the water lines here so we make sure that everything that we're using in our water lines is safe for you. So many things. So I added that next. And then doctors started asking me about laser usage. So we said, all right, what are lasers? How do we use them? I had a laser, but I didn't have a big laser. So now we have something called a Lightwalker laser here. In the corner you can see. This Lightwalker laser has 2 different kinds of lasers, one called an EndoYag and one called a Nerbium YAG. That means we can do treatment like gum recontouring, gum disease treatment. We can clip tongue ties and lip ties on adults and in infants. We can actually cut teeth without numbing you for fillings. We can cut bone if we're going to do some gum and bone surgery, all sorts of things. Let me show you this over here too. This is something called a scanner that we use. Instead of the squishy impression materials that you used to use, this is the digital scanner where we scan your mouth and take a wonderful picture, just turned it on, take a picture of the mouth, and we can send that directly to a dental lab without having to take those squishy impressions. So these were all things that we were doing here. We started changing the way that we were looking at your mouth when you come in for a cleaning. It's not just a cleaning here. We look and say, okay, what's your airway like? What's your blood pressure like? What does your tongue look like? How are you sleeping? All these kinds of things. So this is our hygiene department here, and that's what we're doing over here. Then things started growing, and we started finding hidden infections. We started using a CT scanner and having every single new patient have a CT scan. Well, all of a sudden, I found things that I didn't know were in people's mouths. I didn't know that these were issues. So, started doing a lot of surgery, removing failed root canals, finding hidden infection where wisdom teeth had been removed. And what did that mean? It meant that we were getting really busy, and we were starting to, burst out of the seams a little bit here in the original office. So I had a neighbor next door. He was a dentist, and he'd been here for about 15 years as well. He was slow. His practice hadn't really grown very much, and I really wanted to be able to use this building right next door. So I talked to him, and this is just kind of what I do. I found him a new job. So I found him a new job about a block south. He's now sharing some space there with another dental practice, and we moved into his space. So once we moved into his space, we renovated everything and turned this into our multi-use clinic. So this is our surgical center. This is the reception area in the surgical center now. So this is our surgical center. This is also our, what we call our craniofacial department for sleep issues, for jaw issues. It's also where we see all of our complete comprehensive new patients. So if you have health issues, this is where you come. So let me show you one of these new patient suites. This is where you come and you visit with us. So, there's a dental chair, but there's also an area here where we just sit and we look at your CT scan and we evaluate all that together. And it's really a much more comfortable situation. So we're doing a very comprehensive new patient exam. You're here for a couple of hours. These are our surgical suites. We have a full surgical office here. So for full surgical office, you can see we have everything here. We have nurse anesthetists come and do sedation for us every single day. And we can take care of all surgical needs here. And our surgeon is literally top notch. You can see some of the equipment he uses, water lays, another different kind of laser, all the IV treatments we do for nutrition, for better healing, all those kinds of things. We also have our brand new, I've been using a CT scanner for years, but we have a brand new one here. Why did I get a brand new one? This is a pretty cool machine right here. This can take a scan of your entire head, pretty much from here all the way down to here. I can see everything. I can see spine, I can see airway, I can see head and neck, I can see the brain. I can see so much with this scan. It's absolutely incredible. These are our sleep and airway rooms here where we're really talking about how to heal joints without surgery, where we're helping with sleep to improve our sleep and improve airway and take care of sleep apnea issues, all those kinds of things without CPAPs, without appliances that you have to wear every night, all those kinds of things. This is our education center. A large part of what we do here is our own team education. So we have, screens here, and we're teaching our team all the time in this facility. So that's the behind the scenes tour. Everybody else is gone. I'm just here late tonight finishing up notes, and I thought, you know what? Let me show you around. Let's show you what we have going on here. I have multiple doctors. I have a partner that's wonderful. She takes care of our pediatric department. I didn't even talk about that. We have a pediatric department where we do all of the health and wellness for pediatric patients as well. She takes care of our pediatric patients. We have a full-time periodontist, which is a surgical specialist. We have a full-time doctor that does our sleep and TMJ. We have 2 full-time doctors that do all of our fillings, crowns, all those kinds of things as well. And we have a pediatric dentist that comes in a couple of times a month and helps with that. We also have a full line of supplements. These are my own formulations, the mouth rinse and the tooth powders. And then we also have some other formulas for gut health, for tooth and bone, to remineralize teeth, for gum health. This is also a nutrition line that we use for post-surgical patients with some protein powders and other things. So many things. Basically, we are a one-stop shop for health-based dentistry. And if that's something that you are thinking that could benefit you, which I'll tell you, it benefits a lot of people. If that's you, we would love to see you. We do virtual consultations as well as in-person consultations. I had a person fly in today from Colorado and another from New York. We love everybody. We love to help you. So please let us know if that's something we can help you with.